let's begin with the latest data from the Health Ministry that has come out this evening. You can see there 591 new cases being reported across India in the last 24 hours. The number of people dead, 20 in the last 24 hours. After 2 days where we saw a slight decline in cases, it has gone up just a bit again at 591 cases. The sharpest increase though in a 24-hour period was on the 6th of April, as you see there, with just over 700 cases. So the number is steady and this is the most crucial week of all. Experts and doctors have been saying that the impact of the lockdown, now that it has crossed the 15-day mark, we'll really get to know about that over the next few days, and that is why this is particularly important. So that is as far as those numbers are concerned. Now, the Prime Minister is going to be holding a video conference with Chief Ministers tomorrow morning. It's only after that that the centre is going to take a final decision on extending the nationwide lockdown, and if it's doing that, what shape and form that may take. But Odisha today became the first state to fully extend the lockdown till the 30th of this month. Chief Minister Naveen Patnaik appealed to the centre to do the same as well, while also saying that life can never be the same again. The Odisha order says that educational institutions will remain closed in the state until the 17th of June. No flights or trains will operate till the 30th of April, and the same has been suggested to the centre as well. As was decided earlier also, there will be the free movement of goods, transport will be allowed, agriculture, animal husbandry, all of those activities will also be allowed following social distancing norms. Meanwhile, an expert committee of doctors set up by the Karnataka government has submitted a report saying that there is no medical reason to continue with a full lockdown after 21 days and that it should be lifted phase-wise, even though life will not be normal as we know it for at least 6 months. The committee, which includes Dr. Devi Shetty and others, has said that there should be a phase-wise lifting of the lockdown, which is essential to prevent public frustration, to instill confidence and provide livelihoods. They say that the increasing number of COVID patients in India is there because most of these people got infected before the 21-day lockdown was actually announced. They've warned that we're likely to see rapidly increasing numbers of cases for the next few days. It will be followed by a plateau and then a rapid decline because of the effect of the lockdown. The 21-day lockdown might bring the mortality rate down by at least 50%, they say. The doctors have also said that India simply cannot sustain a prolonged lockdown, and therefore a lockdown should only continue in localized identified hotspots for 2 weeks more. That's till the 30th of April, that there should be strict social distancing that should be enforced across the board till the 31st of May. Educational institutions should also be closed till the 31st of May, as well as gyms, bars, hotels, shopping malls, religious institutions, cinemas. They should stay closed till the end of this month. Air travel, train travel, they say, should also be resumed after the 30th of April. Well, Dr. Sudhakar K, the Minister for Medical Education of the Government of Karnataka, joining us on the program this evening. Dr. Sudhakar, thank you for being with us this evening. What do you make of the committee's recommendations, this committee of doctors and their suggestions to the Karnataka government? Does the government endorse these views, or are you going to wait for the centre to take a call?
It's an initial report from Dr. Devi Shetty and team Dr. C.N. Manjunath and others. The panel of experts of the doctors, they have given us certain, for the government they have given certain things which government is validating about its intent, because we have to consult a lot of stakeholders, the society's stakeholders. So today we had a cabinet meeting where each of the cabinet minister had expressed their own views. So we need to take social aspects into consideration along with the medical aspects. Though this committee says that the medical reasoning for complete lockdown may not be the right, should be a staggered approach, and they said that for the first 2 weeks, we need to see how the staggered approach will see the number of cases, whether it is going to increase or decrease. So this is the kind of the committee that has given a lot of information on various other things, but the cabinet has taken certain viewpoints today. But before concluding, I think on the 11th of this month, where our Honorable Prime Minister is going to hold a video conference of all the Chief Ministers of this country. So I think our Chief Minister is going to decide only after that meeting, and after that I think he is going to consult all the stakeholders of the society in this state before taking a final conclusion. Because you know that Karnataka state is doing quite well compared to the largest states in the country. We are today on the 11th in the thing, because today we have reached about 197
I wanted to ask you about that. I mean, has
cases,
that, it is largely being attributed, the success in Karnataka, relative success is being largely attributed to the aggressive, relatively aggressive testing, the tracing and the containment that your government is following there. If you could tell us more about that. The other models now that we're now being seeing replicated in Delhi and Mumbai now. Bhilwara and Rajasthan did it successfully, but has it just been this containment that has been the main reason for the success?
Yeah, absolutely. We were the first of those states to take a cue from the Honorable Prime Minister's advice, and we started to ensure that we in both the international airports of Bangalore and Mangalore, we started screening of the patients. The 4 T's we applied very well in the beginning of the story. That is tracing, tracking and testing and the treatment. The 4 T's we implemented very well using the technology as well. Since Bangalore being the Silicon City of this country, we have used the technology to our advantage. Especially the quarantine, we have done it in a very, very tough way. So today if you see Bangalore city, because of the quarantine methods and the surveillance, today the curve is almost flattened here in Bangalore. So today only 3 cases are there. So there are stray incidents all over the state. But I feel that the prevention and preparedness in the Karnataka government, that is the key to this. Because the preparedness, we were the first ones to start up almost 1,000 dedicated COVID hospital in Bangalore. I think the other states have taken a cue from there,
ask you though,
and they have started implementing.
Will you be increasing testing though? Because again, that's a concern not just for Karnataka but for all states, that we may not know the true extent of how this disease has spread until we test much more vigorously. Now, some states like the Union Territory of Delhi has already said that there will be much more testing. Today, the ICMR has also said that people who have cold and flu symptoms and fever, who are in hotspot zones, will have to be tested for COVID within 7 days. Now, is that something that Karnataka is looking at as well, expanding the scope of testing?
No, absolutely. One has to test more to understand where we exactly stand. That is the whole reason why Karnataka has increased the number of labs too. Thanks to ICMR to approve almost 15 labs in Karnataka. We were initially only 3 labs, but today we have 15 labs with 3 private labs into this. So our capacity of the real-time thing has gone up to 1,500 to 2,000 tests per day. In addition to this, we are already ordered 1 lakh rapid test kits, which is going to come in a couple of days, and I think in next 8 to 10 days, our target is to test at least 1.5 lakh people in the society. Especially our approach is that since we have already tested almost all people who are symptomatic and international travelers, the second line was the first contacts of the international travelers were tested. Now, in this third stage, what we are trying to do is, we want to test all those secondary contacts of the primary and the international traveler. So, we want to ensure that we check randomly the community spread is there or not in the state. Once we do that, then we will be able to tell where the Karnataka state stands.
All right, that's an important point. Dr. Sudhakar, thank you so much for joining us on NDTV this evening. The Medical Education Minister of Karnataka, they're telling us that Karnataka will be increasing testing, including to those secondary contacts of those who travelled abroad, and much more random testing as well over the next few days. That should perhaps give a better picture of where things stand, at least in Karnataka. Thanks very much, sir. Well, we have Mr. Pinaki Misra, Lok Sabha MP of the BJD, national spokesperson of the party. Joining us as well is Dr. Sangita Reddy, the Joint Managing Director of the Apollo Hospitals Group and the President of FICCI. Pinaki Misra, to you first. Odisha deciding to take the first step and extending the lockdown fully till the 30th of April. Now, we see a very different recommendation from a doctors' committee set up in Karnataka, which is what we were talking to Dr. Sudhakar about. They are saying that there is no medical reason to extend the lockdown beyond 21 days and that there needs to be a staggered lifting of it as you watch things carefully. Can you give us the reasons why you felt Odisha needed to do this whole hog?
Nidhi, Mr. Naveen Patnaik, the Odisha Chief Minister has been ahead of the curve all along. 4.5 crore people, we are now at 44. We've gone up by 2 in the last 72 hours. That's in terms of people who've been identified. Only 1 death. He wants to be ultra careful. The cabinet decision today was that yes, it is a race between economics and life, and life prevails. It's as simple as that. As usual, he's ahead of the curve in terms of legislation as well. The Epidemic Act has now been amended by an ordinance today in Odisha, and there's a 2-year maximum period of punishment, which is now mandated. So it's going to be very stiff penalties. Mask is now completely going to be the norm. Everybody who's in public must wear a mask. Otherwise, there is a first penalty, a second penalty, and then a very stiff third penalty. So, like I said, he wants to be cautious, and I think his caution has paid great dividend till now. Yesterday, in the Prime Minister's meeting, I had requested that, I've been mandated by my Chief Minister to say that please give us the flexibility to take our own decision. The states have to take their own decision, Nidhi. There cannot be a one-size-glove-fits-all. That's not possible. So therefore, we've taken a decision looking at our exigencies. Food security, okay. He's very comfortable with that umbrella we've given, the food security umbrella. There is going to be complete free movement of goods as far as food is concerned. So therefore, I don't think that we need to be therefore guided by what some other state feels is their exigency, and that's the whole point of health being a state subject. Each state must take a call. That is an important point.
In fact, perhaps one of the big lessons to take away from this pandemic has been the importance of letting states take their own decisions, depending on their unique circumstances, and that's a bigger discussion we need to have, Pinaki Misra. But Dr. Sangita Reddy, do you, as somebody who is president of FICCI as well, you wear both these hats. Do you feel that the country can afford to have an extended full lockdown, even if it's for another couple of weeks?
I can't hear you.
Ma'am, can you hear me now?
No.
I think you can, because you can partly hear me because you're saying no, you can't hear me.
Partly hear you, yes.
Okay, so let's try it partly.
Okay, Bet, go ahead.
Okay, I was just asking you that as president of FICCI, do you think India can afford to have an extended national lockdown, even for just another couple of weeks?
So I think clearly this is one of the most difficult decisions facing every leader and every individual. And it's very important for us to take a very calibrated decision. I also want to state that this is not an all or nothing kind of game. We can go in a very well-planned manner of which are the hotspots, where do we clamp down and continue to keep the lockdown, where can we open up, and this can be done in a phase-wise manner. So there's clearly schools, colleges, entertainment zones, areas of high crowding should remain in lockdown. Manufacturing in a very well-planned way in which they can house their employees, ensure distancing, ensure sanitary conditions should be opened and should be planned well. Agriculture, which is one of the biggest things, the crop is happening right now. So harvesting is very, very crucial for the country because there's health security on one side, there's food security on the other, and then there's economic security. So there is no single sweeping answer. It's an intelligent, well-planned, phased manner depending on the critical parameters which are being analyzed, which is what is the extent of the infection, what's the ability to contain, what's the healthcare available in that zone. And
See,
when
what
you
you're
put
saying
all
is
these three
important because
together, you
you're
will
saying
figure out
that
which are the areas which have to be
But in other
carefully
words, you're saying a
cordoned off.
blanket lockdown the way it is now may not be the best way forward, that perhaps it would be good to look at specific zones, specific areas, and in a very phased and staggered manner allow some kind of economic activity to restart. Pinaki Misra, is that something you think Odisha too would want to look at, once the 30th of April is over? Because extending lockdowns in a poor country like India, a blanket lockdown is going to be very, very difficult. So do you think Odisha too, like some other cities and other states where hotspots are being identified, may want to do something similar?
Nidhi, Mr. Patnaik is always going to be open to any kind of rational decision making. For instance, I've just got a message saying that the Ministry of Road Transport under Mr. Gadkari has taken a view that there's a possibility that they may allow kickstarting economic activity in terms of road transport and highways to explore ways to restart construction work on big highway projects where laborers are still available on site and with all the safety norms in place. That's possible. Now, if that's possible, I'm sure the state government, if it gets that kind of proposal, will look at it very, very constructively. There's no question of any ossified structure in this matter. Therefore, I have no doubt that any kind of constructive dialogue with the centre, which will bear some sort of fruition, the state government is going to be open to it. Mr. Patnaik has always been open to it. Let's see what the Prime Minister first has his meeting tomorrow, and thereafter different ministries, what sort of plan they lay out over the next 2-3 days. And then we will get a better picture.
Dr. C.N. Manjunath, who's a member of the Karnataka Expert Committee on COVID-19, also joining us from Bangalore this evening. And Dr. Manjunath, I was just reading out some of the key recommendations that your committee has made, which also includes not continuing with a blanket lockdown after these 21 days are over. You've given various reasons for it, but you've importantly said medically there is no medical reason to continue it, although whatever we do from here on would have to be very staggered. It would have to be very, very carefully calibrated. Dr. Manjunath.
Yeah, see, there is an uniform consensus here also. That means there is a need for extension of the lockdown, particularly in hotspot area. There is no question about it. Because if you look at Karnataka scenario compared to the other states, at this point of time, it could be less in Karnataka, but compared to previous week, this week we are seeing a more number of cases. And also there are definite clusters coming up in various parts of Karnataka. So definitely there is a need to extend the lockdown in these hotspots. And it's a dynamic thing. So whatever report that has been given by our group, it is a dynamic thing. It need to be, reviewed periodically, weekly basis.
Right, but Dr. Manjunath, you clearly have talked about, again, focusing on hotspots, and your report also says, keep, theatres, malls, or you can keep all those crowded sort of areas closed a little bit longer for a few more weeks, but you are in favor of restarting in a calibrated way some economic activity sooner rather than later.
Yeah, that is because what is happening, probably we have to have a relook at that. Now we have started, some officers should work with 50% strength on a rotational basis. And also we have to see whether industry, because most of the migrants, the laborers and also the daily wagers have moved out of the Bangalore city to other parts of the state. So probably even if you want them to work, we don't have a full strength at this point of time. And even in other places, suppose even if the places where there is 0 cases of COVID-19, still the restriction stays on. The inter-district movement is not there. with respect to buses, or only the essential goods are allowed, and they have to practice this physical distancing. They have to wear compulsorily masks, and at the same time they have to give importance to personal hygiene. So, and even if the buses are plying in those within the particular district, they have to maintain social distancing, alternate rows they have to sit. And of course, schools, colleges, bars, restaurant, clubs, they are continue to lock down. Even in cities also, the vehicles are interstate transfer is not allowed. The flights, whether it is domestic, international flights, and also the trains, and including metro, the restriction continues up to April 30th.
Up to April 30th. Dr. Sangita, Reddy, just to sort of then get your thoughts before, because you're joining us on the panel with other industry voices in just a short while from now on how we can get back on track. But some of the numbers coming out of the economic impact of this lockdown are very scary. When you look at the overall growth numbers, etc. And you head Apollo Hospitals as well. How do you make that balance between lives and livelihood at the end of the day, especially in a country as big as ours?
See, I think the priority of the country was appropriate in the first instance. Once we saw reports from all over the world, the Prime Minister and the leadership very appropriately went into an acute lockdown. And I think that's really what saved the country so much. You look at us compared to every other country in the world, we have really come out relatively unscathed. So now is to move very cleverly into the next phase, which is you look at the movement of people, movement of goods, restarting of manufacturing, and the phase of a particular geography or the gradation. And if you put these four indices together, we will progressively evolve the right formula. But a complete lockdown is something which is, I think, no longer the right answer, and we can find a way. This 3 weeks has given us a breather to understand the scenario, to learn these new behaviors, to appreciate the new normal, to figure out how we work from home, study from home, social distancing. And now we must start planning, how do we keep, say, a factory open for 12 hours? So that you can achieve the same productivity, but you have less people in that building at the same time. Should we do the same for shops so that there's never any crowding in the stores? So we start planning these kind of things because we understand what do we need to achieve. We need to achieve distancing, so we should be clever about the movement of people. We need to make sure that only essential things are starting. And then, like I said, manufacturing and agriculture are two very crucial aspects. We have to get them going. Much as we would like to do hospitality and aviation, this is not the time. So the lockdown is a combination of geography and sector. And that's how this has to be planned and calibrated.
Right. Well, as Dr. Manjunath was saying, don't start flights and trains at least until the 30th of April has passed. So perhaps that is something that the centre may consider doing as well. Thank you very much to all of you for joining us this evening with some perspective on how these lockdowns should proceed from here. Odisha taking the lead and deciding to go ahead completely till the 30th. Will the whole country follow? We'll know in the next couple of days. Thank you very much.